Today's video is going to cover Chapter 21. We're going to talk about habit reversal procedures. Now, at the very beginning, we're going to talk about a sort of non-official definition, a colloquial definition, which I can never quite say that word right, but this is just an unofficial definition, not from the textbook, but more from looking things up in an online dictionary, where we can define a habit as a settled or regular tendency or practice, especially one that is hard to give up. So an informal version of this is some kind of addictive practice, and they say especially one related to taking drugs. For psychology specifically, they call a habit an automatic reaction to a specific situation. Now, our official definition of a habit is simply going to be a repetitive behavior that falls into one of three categories. It's either a nervous habit, it is a tic, which also encompasses Tourette's disorder, or it falls under stuttering. So those three categories are all what would be considered habits. And we're going to talk about each of these three sections independently. So let's start off with number one, nervous habits. So nervous habits are repetitive and or manipulative behaviors that are most likely to occur when a person experiences high tension. So they are habits, repetitive behaviors that you tend to engage in when you are experiencing quite a bit of tension or nervousness. Things like nail biting, hair pulling, oral habits, thumb sucking, and bruxism. Bruxism is just a fancy term for saying that you clench your jaw really tightly, and that can cause damage to your teeth. Now, I myself am actually someone with nervous habits. I am bad for nail biting, and I find I can go long periods of time without biting my nails at all, but during periods of high stress, I tend to do it fairly frequently. So I found it kind of interesting to read this chapter because they point out different ways to try and help mitigate that behavior, which some of them are things I've stumbled across during my own life as I tried to stop that habit. Now, a lot of nervous habits are typically not socially or environmentally reinforced. They're not something that you get attention from or anything like that. They tend to mostly be maintained by natural physiological reinforcers. Basically, they help you disperse some of your nervous energy. Though sometimes maybe the sensation of doing it can become calming or something like that. But yeah, typically not maintained external to the individual. Now, a lot of nervous habits tend to be harmless unless they're taken to extremes. So occasionally biting your nails or pulling gently on your hair isn't going to be a big problem, but if you do it consistently or aggressively, it can cause pain, can cause discomfort, it can be embarrassing if it draws people's attention, and any of those cases would cause it to become a problem. For our category number 2, we can talk about tics and Tourette's disorder. So we have three categories: motor tics, vocal tics, and then Tourette's on its own. So for motor tics, these are repetitive jerking movements of a particular muscle group in the body. So this could be something like turning your head a specific way or twitching your hands a particular way. And a lot of motor tics will arise simply from, say, getting into the habit of doing something. Maybe you suffered an injury and you started popping your neck to help relieve tension. And even after the injury goes away, you maintain that popping behavior. But again, if it's not an extreme behavior, if it's not happening constantly, if it's not bothering you or others, that habit isn't really a problem. Same thing with vocal tics. These are repetitive, this time vocal sounds or words that are uttered by a person that specifically serve no communicative function, meaning that you're saying things without trying to communicate something. So this doesn't have to be saying words out loud. This could be something as simple as clearing your throat or saying repeatedly or something like that. Those would all count as vocal tics. And then Tourette's disorder is a special kind of tic disorder that involves multiple motor and vocal tics, and specifically those tics have to have occurred for at least 1 year. Now, it's important to note that individuals can have either motor or vocal tics without it falling under the category of Tourette's disorder, especially when people are younger. In children, they tend to get motor and vocal tics fairly easily, and they also tend to grow out of them. So you don't always have a diagnosis of Tourette's if you have individual motor or vocal tics. So you would be diagnosed with Tourette syndrome if you have a chronic occurrence of both motor and vocal tics, and that they last more than a year. And I have shared a video about Tourette's disorder on eClass. So if you wanted to take a moment and watch that, it's just a sort of mini documentary talking about Tourette's disorder if you're not familiar with it. One of my friends has Tourette's, so I kind of got sort of used to it and educated on the topic quite a while ago. So just something interesting to look into. All right, category number 3 is stuttering. So this is slightly different from a vocal tic because it's not an involuntary utterance. Instead, stuttering is a speech disfluency, basically meaning that you are not fluent in your speech. And so the individual repeats words or syllables, they prolong a word or sound, and or halt on a word. So repeating a word would be something like you're trying to get out a sentence and you get stuck on a word and you repeat that word over and over again. So if you're trying to say, I'm walking the dog, and maybe you get stuck on I'm. So you would say, I'm, and then you could move on to walking the dog. So that's the disfluency where you've gotten stuck on a word. You might prolong a word or sound where you can't say the full word. You maybe get stuck on a vowel. So trying to talk about going around something. Maybe you get stuck on the ound sound and you draw that word out. So you're going around. That could also be included in stuttering. And then for halting on a word would mean that you're having trouble enunciating a particular word and you just can't force that word out. Now this is different than, say, me right now stumbling over some of my words. We tend not to be very fluent in our speech all the time, but stuttering would be more of a chronic problem where it happens more consistently, and it becomes a big problem if it's, again, chronic and disruptive and causing problems. So a lot of these habits tend not to be overly disruptive or problematic unless they are taken to extremes. Which brings us to our next slide, which is saying, when is it a habit disorder? So when is a habit a behavior, and when is a habit actually a disorder? I've kind of already gotten at this, but when it occurs excessively with great frequency, intensity, or duration, so if it's excessive to the point where the person engaging in the behavior finds it unreasonable, that would classify it as a disorder. If it causes physical damage to the person, so something like hair loss from pulling on your hair, damage to the nails or teeth from biting your nails or clenching your jaw, and if it causes distress, social stigma, or embarrassment to the individual, basically, if it's causing a problem, it can fall under the category of a habit disorder. So if we've identified a habit as a problem and are classifying it as a habit disorder, then we might want to try and reverse that habit. So we can talk about habit reversal procedures. So the habit reversal procedure is implemented in a therapy session with a client who exhibits the disorder. So you tend to have a therapist and their client. So the client would implement the procedures that are taught during that therapy session or multiple therapy sessions to try and control the habit as it occurs outside of that session. So in essence, to go over sort of the basics of a habit reversal procedure, we would start at number 1 with awareness training, where we would teach the individual, the client, to describe the behavior. So we're going to give them a behavioral definition so that they learn to identify when the habit is occurring or when it's about to occur. So if we're teaching them to discriminate or detect when the habit is occurring or when it's going to occur, if you can identify some antecedents of that behavior, you might know that it is likely to occur soon. That's really important to know what the behavior is and if it is occurring or will occur soon so that you can start taking action to start preventing its occurrence or making it less likely to occur. Which brings us to our second step, which is learning a competing response or competing response training. This stage involves learning a behavior that's incompatible with the habit behavior. So you would prompt and then reinforce an incompatible response in anticipation of the habit behavior. So if you are engaging in the habit behavior or you are about to engage in that habit behavior, you should instead prompt yourself or have someone else prompt you to engage in some kind of competing behavior. This competing behavior should also be something that's socially inconspicuous, basically meaning that your competing behavior shouldn't draw a lot of attention. So you want to find a behavior that you can do instead that would compete with the problem behavior, and it should be something that you can do without drawing a ton of attention. So let's look some more at this and find some examples of competing responses. So for an example of motor tics, so instead of having repetitive motions, maybe you could lightly tense the muscles that are involved in the tic while holding those parts of your body still. So if you have problems where you jerk your neck in a particular direction, and if you feel that motion coming on, then you could lightly tense your muscles, maybe tilt your head forward a little bit to engage those muscles, and hold your head still. And while you're doing that alternative behavior, that competing response, it's very difficult, if not impossible, to also engage in that motor tic. For vocal tics, you could focus on slow, deep breathing through the nose with your mouth closed. So by breathing through your nose and not engaging your mouth, it's a lot harder to engage in vocal activities. For nail biting or hair pulling, one of those nervous habits that involve the hands, you could keep your hands on your lap or in your pockets. You could grasp an object or keep your hands under your arms where they can't engage in that biting or pulling behavior. For bruxism or other oral habits, you could hold your teeth slightly apart or lightly teeth clenching. So the light teeth clenching would work better for other oral habits like biting or chewing on things. It would probably be counterintuitive to do bruxism and light clenching because bruxism is hard clenching. But if you force your teeth apart, then you can't bite on things and you can't clench your jaw. For stuttering, you could use a special kind of breathing, diaphragmatic breathing. So you breathe very deeply using your diaphragm. And if you use a slight exhale before speaking, it tends to help with stuttering to get those words out. So these are all competing responses, things that would interfere with your ability to perform those problematic habits. So let's go back to our habit reversal procedure. Step 1 was to be able to identify when that habit might occur. Step 2 is proposing and getting competing behaviors to start happening. Step 3, which doesn't necessarily have to happen in order, but we're listing it as step 3, is to engage social support or incorporate social support. And this is when you get some significant other, whether it be a parent, spouse, friend, or someone important in your life, to get involved in those treatments. So an example of this would be getting a parent to prompt a child to use the competing response. For example, my parents would remind me not to bite my nails as a child. So instead of just saying, don't bite your nails, maybe they would say, try holding this pencil instead. Or, why don't you sit on your hands? That would be a prompt to use a competing response so that I would engage in less of that nervous habit. A parent could also socially reinforce a child for absence of the habit or for correct use of a competing response. So if I went for long periods of time without biting my nails, they could compliment me on that or tell me how good my nails were growing. Or if I was frequently sitting on my hands or doing something else to keep my hands busy, they could tell me I was doing a good job. You can also use for social reinforcers things like praise, hugs, kisses, smiles, high fives, basically anything that makes you more likely to do those competing behaviors or to not engage in the habit behavior. You want to reinforce something else. Our last piece of our habit reversal procedure is to engage in a motivating strategy. So in this case, the therapist sits down and goes over with the client when the habit occurs and how the habit has affected them. This review increases the likelihood that the client will use the competing response outside of treatment sessions to control the habit. Basically, it reminds them of how detrimental this habit has been and how often it can occur, so that they kind of remember how inconvenient and even embarrassing it might have been to engage in this habit that frequently, or how problematic it's been. So just reminding them how important it is to maintain this habit reversal procedure to try and reduce the occurrences of those habits. Now, a lot of research has shown that having a competing response can help reduce the occurrence of habits. But why does it actually help? Why does our competing response help reduce the occurrence of those habits? There are two possible proposals. It doesn't mean that sort of one or the other is correct. We actually kind of see that both can be correct depending on the situation. But one is that this competing response has an inhibitory function. So if the competing response is incompatible with the habit, then it makes it impossible for the habit to occur. So if your habit is head shaking behaviors, you can't both shake your head and tense your neck muscles. You kind of have to do one or the other. So if you engage in that competing response, you cannot engage in the habit. There's also some evidence that the competing response can serve a punishing function. So it's kind of like a form of contingent exercise where doing this competing response usually involves some sort of effort. Whether it's tensing your muscles or moving in a specific way, it's involving extra effort that you wouldn't have had to give otherwise. And by having to put that extra effort into it, then it becomes punishment for doing that behavior. And in the long run, having that extra thing that you'd have to do if you were going to engage in the behavior actually makes you less likely to engage in those habits, which is really, really cool. So let's look at an example done back in the 1980s where they showed this punishing function of our competing response. So like I said, prior research has shown that things like muscle tics can be suppressed by the performance of a competing response that's contingent on the occurrence of a muscle tic. So if twitching your head side to side is your habit, tensing those same muscles can prevent you from doing the habit because they compete. In this example, in an effort to determine whether the topography of competing response was important to this muscle tic suppressing effects of our contingent competing response practice, they ended up evaluating a competing response that was dissimilar to the muscle tic. Basically, they were looking for something that wasn't necessarily mutually exclusive to that tic. So it would be something other than, say, using the same muscles or something like that. So by being topographically dissimilar, it means that the tic and the competing behavior could occur at the same time. So if we look at this diagram over here, we're looking at 4 different behaviors exhibited by 3 different individuals. So the mouth twitch was done by one individual, head jerk and arm jerk were both done by a second individual, and the nostril flare was done by a third individual. And so they had set it up so that they have competing responses, one with a dissimilar contingent, basically meaning that they could do their habit and this competing response at the same time with no problem. And then they had similar contingent where you couldn't do the habit and the competing response at the same time. So they had each individual. So this individual, their habit is the mouth twitch. They had them have a competing response that didn't directly interfere with that twitch. And then they had a competing response that did directly interfere with that habit. And they checked how their behavior changed. So for each individual, they started with a baseline. And you can see they have staggered onsets of each of the stages just to get some consistency and more experimental relevance with their data here. But they recorded the baseline amount of their habit that they observed, so how much of a mouth twitch was being observed. Then they had their dissimilar contingent, so for our person who twitched their mouth, they tightened their right bicep. So that's just putting effort. It's in another part of their body. There's nothing that would stop them from both tightening their bicep and twitching their mouth. But despite that lack of overlap, we still see that they reduced the amount of mouth twitching when they had to put the effort into tensing their bicep. And we still saw lowered rates of responding or lowered rates of habit performance when there was a direct interference. So if they had to clench their jaw here, we still see a reduction as well. But the cool part is that even if the competing response wasn't directly interfering with the habit, it still reduced the occurrence of that habit. So this tells us that this punishing function can actually have a pretty strong effect on that habit. It's not just the inhibitory function, there's some kind of punishment going on as well. Now, to wrap off this chapter, we want to talk about the fact that we might need to incorporate other kinds of treatment procedures. So, habit reversal by itself might not be ideal, especially if individuals aren't capable of engaging in all of those steps of our habit reversal procedure. So, very young children or people with intellectual disabilities might not be capable of recognizing an upcoming or occurring habit, and they might not be able to engage in some kind of competing behavior on their own. So, they might need to use something else. Or sometimes the habit reversal on its own just isn't sufficient. Maybe you don't notice that you're engaging in the habit because it happens so much in the background, or maybe, I don't know, you're having problems for other reasons. But we can use this habit reversal procedure with a bunch of the other procedures that we've talked about so far in this course. Things like DRO, response costs, response blocking, self-monitoring, even goal setting. These can all be used in conjunction with habit reversal, whether it's because you can't use habit reversal on your own or you just need the extra help. These are all great options to help reduce the performance of those habits if they're a problem.